Hi, I'm Bobby Sasakmus, and I'm the Community Wellness Champion at Crime Machine Health Society. I'm here to talk to you a little bit about the take-home Naloxone kits. These kits were implemented in the province on August 31st, 2012 in response to the provincial opioid crisis. They are free to absolutely anybody that would like one. And additionally, there's a Naloxone nasal spray available, which is also free to anyone who obtains a valid status card. So Naloxone, also known as Narcan, is a intramuscular injection or nasal spray that is utilized to reverse an opioid overdose. An opioid overdose is that of a depressant, so it's going to shut down the body. The signs and symptoms that you might see are the person is going to be very lethargic. They might even be unconscious at this point. Their skin could be pale, it could be ashy depending on what their normal skin tone is. They could be cold, clammy. Their pupils are going to be very narrow. They might be rolling back into their eye sockets a little bit. But most importantly, you're going to notice their breathing is going to be very slow. It's going to be labored. You might get gargling or choking sounds. Because their body is losing that oxygen, you might notice too that their fingertips and lips are going slightly blue in tone. As the body begins to shut down, the organs are getting less and less oxygen, and the person is at risk for brain damage or other organ failure. These symptoms are the exact opposite of someone who is overdosing from a stimulant. It's important to note that Naloxone is only effective on an opioid overdose. If someone is exhibiting symptoms of a stimulant overdose, it's okay to use Naloxone. It's either going to help or it's not, especially with the drugs that are on the streets. Currently, we're seeing a lot of cross-contamination. So somebody could be using something like cocaine, but it could be contaminated with fentanyl, and as a result, they could be experiencing an opioid overdose. So if you find someone that you suspect is overdosing from an opioid, you want to first try and get their attention. If you know them, just call it their name, maybe shake them a little bit, say, hey, are you okay? If you don't get any kind of response, you are going to want to stimulate a little bit of pain. So you're going to make your knuckles here and press firmly on the chest plate or beneath the nose. If they are overdosing, they likely won't respond to that, but if they're just passed out, you might get a little bit of churning, maybe mumbling. In that case, you're okay. But if not, you want to call 911. If you have to leave them to make that call, you want to put them in the recovery position where they're on their side with their top leg at a 90-degree angle in front of their body, and likewise with their hands at a 90-degree angle and their face perched, so that if they do vomit in your absence, they're not going to choke. If you're able to stay with them while you make that phone call, you can leave them how they are as long as their airway isn't obstructed and you're able to monitor them to make sure that they don't vomit. If they do, just roll them over. So once you are on the phone with 911, you want to tell them that you have found someone that you suspect is experiencing an opioid overdose. They are unresponsive. They will generally stay on the line with you and walk you through the steps of Naloxone. And if not, if they hang up, and you will always have the steps in your case as well. So when you open up this kit, it's gonna have 3 single-use syringes, 3 vials of Naloxone, a one-way valve face mask, a pair of gloves, and an alcohol swab. We have the Save Me steps here, so it provides all the steps that we are talking about right now in this video, just for anybody's reference. So once you've made your call for 911, you are going to roll this person onto their back, make sure that their airway is open, the neck is at a 90-degree angle, and you're going to put on your gloves. You are going to look into their mouth, make sure that they're not choking on anything like chewing tobacco, gum, food. With your gloved finger, you're going to do a mouth swab. Everything is good to go. You're going to start providing breaths. It's really important that you provide 1 breath every 5 seconds, because again, a person can start to experience brain damage if they are not getting enough oxygen into their body. So in order to start providing those breaths, you are going to take out your one-way valve face mask. As you can see, this portion here that protrudes from the mask is going to go between the teeth of the recipient. with the mask draped over their face. You will pinch the nostril when providing the breath, otherwise that air will escape out of their nasal passage. If you're by yourself, things get a little bit more complicated because you want to do one breath in between each step. If you have someone with you, they can focus on the breaths and you can focus on the steps. So you want to provide those breaths, one breath every 5 seconds for up to a minute. If you notice that the person is starting to become a little bit more responsive, you should be good. Just continue to monitor them, make sure that they are able to breathe on their own, and stay with them until those first responders come. If they don't start to come to, you want to start preparing your naloxone for the next steps. So you are going to open up your naloxone vial here. These are just water for training purposes. It is a glass vial, and if you take off the protective cap there, you can see that the water line is quite low. It's very important that you remember to swirl your vial because the liquid level will rise. You put your cap back on, and when opening this, you always want to open it away from yourself. If you put your fingers on the center of the vial and your other fingers on the outside, and make sure that you're putting force on each end and the center, point it away from yourself and press into the middle, and you'll hear a crack. When you have your vial open, you don't want to have to worry about any little shards coming out, so always make sure that you put it outwards from yourself. These single-use syringes are quite hefty. They each come individually wrapped in a sterilized package, and they each have a cap on them. So you can take them out and then open your naloxone, or open your naloxone and take your needle out. It doesn't matter. They're both interchangeable steps, as long as you leave the cap on until you're actually ready. These syringes are really great because they're such a thick needle that they can be injected through heavy clothing like Carhartts or winter jackets. But if you feel like you have time and there's exposed skin, you can take out the alcohol swab and clean an injection site. When you're drawing up your naloxone, you're gonna put your needle at the bottom corner of the vial and slowly but firmly push upward onto the needle, and you will see that the medication is being lifted into the syringe. You're gonna hear a gargle and see some bubbles pop up, and that's when you know that you've got it all. You're gonna then point your needle upwards towards the sky at a 90-degree angle, and you're gonna slowly push out all that air. It is okay if you get a little bit of air in there. It's not preferable, but it's better to have that than to actually squirt out some naloxone like that. You wanna maintain as much of it into the vial as you can. When you're getting ready to do your injection, you are gonna go for those very thick muscles. You're gonna go for your bicep, you're gonna go for the side of the thigh, or the upper buttocks. And think of a dart, just one swift movement into that muscle, and then press firmly down onto the syringe, and you'll hear a click, and see that the needle retracts back into the barrel. It is a safety feature, so you cannot prick yourself after you use it, and someone cannot come along and reuse that syringe afterwards. So once you've administered your naloxone, you want to continue to provide your breaths one breath every 5 seconds, and monitor to see if they start to come to. You will generally notice some changes within 3 to 5 minutes if the naloxone worked. That is about how long it takes for it to get to the receptors in the brain where it boots off that opioid and allows the person to come to and start breathing properly. Sometimes, depending on how much of an opioid a person has consumed, it might not work, and you are going to need to start preparing your next dose of naloxone. So it's very critical to keep monitoring with that time frame. If they do come to, they might be a little disoriented, they might be angry, they might not know what happened. So just try to keep yourself safe, give them a bit of space, and explain to them what happened. Try to get them to remain calm and stay where they are. Explain that first responders are on their way, and encourage them to seek that extra medical attention because they can revert back into an opioid overdose, so within anywhere between 20 to 90 minutes, and it's very important that they get checked out again in case they do need any more naloxone administered. Naloxone is really great because it can be used on someone who's pregnant, it can be used on children, infants. It has minimal side effects. Note about storage, you don't want to leave it into a vehicle. Any like excessive heat or cold can impair its potency, but again, if it's expired or is improperly stored, you can still use it. It's better to use expired or weakened potency naloxone than no naloxone at all. If you would like to receive a kit or for more information on how to use a kit, give us a call at Crumsheen Health Society and we'd be happy to help you.